We have a lot of top experts that will show us which are the most important modalities of treatment about thyroid nodules. And I'm going to start introducing the first speaker, Dr. Enrico Papini. He's an important endocrinologist in Italy, and not only in Italy. He's very famous because he wrote a lot of papers and guidelines. So his talk will be concerning the 2019 European survey on minimal invasive technique for thyroid nodules. Please, Dr. Papini.
Well, many thanks. I am grateful to Roberto Valcavi and to all the organizers for this, well, wonderful, amazing location and for the great level of this meeting. We know that at the moment, the majority of thyroid lesions are still managed with surgery when they become symptomatic. I present you two studies published, one in France and the other one in Germany. And of course, roughly speaking, we can say that still the great majority of treatments with surgery are due not to malignant lesions, but to benign conditions. And even if during these last years surgery was less aggressive, especially for diagnostic surgery, we still have about 40% of the patients that underwent hemithyroidectomy that after 1 year, these are official data, after 1 year need some kind of substitution therapy. And some of them also calcium supplements. And as I told you, we have the same condition in Germany. This is a recent paper from Barch that demonstrated that, similarly to France, about a quarter of thyroidectomies are due to malignant condition, and the other one are performed for nodular goiter and, in a minority of cases, for hyperfunctioning nodules. But we know that surgery, in order to decrease the risk of complications, requires an increasing amount of resources. For instance, with video-assisted surgery or with neuromonitoring, and to prevent cosmetic damage, some very complicated techniques that were presented today are needed. And so it was for this reason that during the last years, we had an explosive increment of the amount of publication that are concerning the different types of minimal invasive procedures. And during the year, starting with the feasibility studies in the late 90s and early 2000s, we are now with a lot of very well-designed, conducted prospective randomized trials, and we are now using also some rather good meta-analysis. But the question is, we have a problem that is a widespread disease that is extremely costly in terms of intervention and long-term substitution therapy. We have an increasing amount of evidence about the efficacy of techniques that are not surgical, but what is the actual present condition in Europe? I present this data but I remember you that Roberto Negro is the other person with Roberto Attanasio and Laszlo Hegedus that conducted this survey. That was a web-based survey that was promoted by the European Thyroid Association. We had the answer of about 250 members of the European Thyroid Association, mostly clinicians and physicians that were dealing every day with the thyroid problems. And of course, Italy, Denmark, France were the most frequent respondents, but nearly all the European countries had some respondents. And so let's have a look at this data. When asked the endocrinologist in Europe if they performed personally minimally invasive techniques, we see that about of the 250 respondents, nearly 25% performed percutaneous ethanol injection, while thermal ablation procedures of different types were performed just by a minority. What is most important, and this is a very representative sample, because as you can see on the top, nearly all the respondents performed usually thyroid ultrasound and fine needle aspiration by themselves. And if we ask if in the center as a whole these procedures are available, you can see that the percentage is increasing, but most of the radiology departments, surgeries, and so on, perform these ablative techniques, especially for lesions that are outside the thyroid gland. And what is most interesting is the question, if you and your center do not perform this kind of treatments, do you refer at least some patient to centers that are well organized and perform usually this kind of treatment? And this is quite discomforting because, as you can see, just over 10% of the respondents told that they, sent for referral their patient to centers with expertise in this field. And last, why you never submit your patient to this kind of treatment? And the answer was, because I don't know exactly what is this treatment and which are the outcomes, and this is 15% of the cases. But most important, because nearly 45% responded that there is no precise statement of scientific societies regarding this topic. And rapidly, we had also some clinical cases, and the first one was a young female with a clearly benign cyst, and you can see that today in Europe, 1/3 of these patients will be submitted to surgery. And we have some change when the person has a more advanced age and comorbidities. But what is extremely interesting is that when we have a middle-aged woman, 45, with clearly benign features and cytology report, with a 4-centimeter nodule that is becoming symptomatic, still 70% of the cases would be treated with surgery, while we have some increase in this kind of non-surgical treatments when there is just a palliative option, like in the case of a rather old lady with severe comorbidities. That is, this kind of treatment is still approved by the majority of the endocrinologists as a palliative treatment that can be performed when surgery is contraindicated or is not appropriate for a patient with a limited life expectancy. And moreover, it was asked also about autonomously functioning thyroid nodules. As you can see, for a small hyperfunctioning nodules in a very young person, 20-year-old, surgery and radioactive iodine are still nearly the only approach to the disease, and similarly is for a more old lady with a nearly 60% of cases that are treated with radioiodine and the remaining with surgery. And so, two rapid conclusions. We can say that we have a relevant, solid, multi-center evidence because we have both single-center, multi-center, retrospective and prospective trial, and several very well-conducted randomized controlled trials. We have techniques that in many centers, in many controlled situations with different tools, provide a volume decrease at 1 year that ranges from 60 to 90% of the initial volume, and we have a nodule regrowth that is present in a minority of cases and is anyway present generally after the 3rd or the 5th year after treatment. And all this is paralleled by a cosmetic concern and pressure symptom improvement. And on the other hand, minimally invasive procedures are still performed only in a minority of thyroid centers in Europe. The wider accessibility is probably in Italy, probably because many of these techniques were born in Italy. The majority of European endocrinologists do not consider the indication to meet as an option for everyday practice, even if for just selected cases. And probably there are several reasons. We know very well that new techniques will suffer from a lag between the demonstration of their efficacy and their widespread use in clinical practice. But there are also other reasons. The first one is a reimbursement that at present is inadequate in many centers from the National Health Services, and still a not adequate endorsement by the major scientific societies, most importantly from the leading journals and organizations from United States that, as we know, in some way have a large pressure in orientating the clinical activities. And so I thank you for your attention, and I suppose that this can be a right way to introduce the interesting work that will follow this afternoon. Thank you again.
So thank you, Dr. Papini, for your presentation. We have time, of course, for questions. Please, are there any questions concerning this topic? Of course, you show us the situation in Europe, and you show us the weak point of the situation. So, can you suggest how can we improve this situation in Europe and also in Italy, improving the possibility to use this technology?
Certainly, there are a few approaches that should be, well, introduced. The first one is that there are no official academic schools for this kind of treatment. The second one is that there is no well-defined statement about the indication, contraindication, and modalities. There are a few statements. The MIT group in Italy provided a statement, but probably this is not a so effective statement like could be from European Thyroid Association, American Thyroid Association. We have just an excellent statement from the Association of Korean Radiologists in Thyroid, but, well, it's Far East and in some way is still a bit far away from Western countries. And so I would say that these are important aspects. And last but not least, of course, for the reimbursement, still we have, in many cases, a reimbursement that is, well, not rewarding, and so in many cases treatments are performed without a sufficient coverage by the national health services. That's all.
Thank you.